Hi everyone, welcome back to another session of Cancer Care at American Oncology Institute, Mangalagiri. Here we have with us Dr. Mani Kumar, MD Radiation Oncology, who completed his Masters from Father Munnar Medical College and Hospital from Mangalore, and he has 7 years of experience in the field of oncology, and he has very special intent of in gynecological cancers, and as well as he has interest in brachytherapy. We welcome you, doctor. And can you explain cancer in simple forms, doctor?
So today we are discussing regarding cancer because cancer is the second leading cause of death in the world following cardiovascular diseases. So cancer is not one disease, but it is a many disorders with widely different pathogenesis, natural histories, and responses to therapy. Like some cancers like Hodgkin's lymphoma are curable, whereas some cancers like pancreatic adenocarcinoma are virtually always fatal. That is, they present in very late stages, and ultimately mortality is the result. And coming to oncology, oncology is the study of neoplasms or tumors. Neoplasia can be neoplasia means new growth. It is a collection of cells. It can be benign or malignant. Benign is usually, it remains localized and it is encapsulated and it is very amenable to surgery. Whereas malignant neoplasias are usually, they spread to other organs and they are invades and destroys other adjacent structures in the body. So in our body, our cells regularly divide and they form new cells. The older cells will die, and in the form of older cells, new cells will form. Whenever this division is unregulated or misses regulation and forms a mass, it is called neoplasia.
So, as we discussed about the simple forms of cancer, can you explain? Could you explain about the etiological factors of cancer?
Yeah. Just like I explained, cancer is not a one disorder. It has many etiological and risk factors. Both genetic and environmental factors contribute, but environmental influences are the dominant risk factors for most of the cancers. Among the best established environmental factors affecting cancer risk are infectious agents like human papilloma virus. In more than 90% of the cervical cancers, the etiological factor is human papilloma virus, and hepatitis C virus, which can cause hepatocellular carcinoma. And in patients of HIV who are infected with HIV, we call it as AIDS-defining malignancies. They are more prone for developing malignancies like lymphomas, anal canal cancers, and some of the sarcomas, etc. And infection with H. pylori, it can cause stomach cancers, and infection with Epstein-Barr virus can cause nasopharyngeal cancers in some of the young individuals. And smoking can affect any system in the body. So in India, usually smoking can be divided into two types: smokeless and smoked tobacco. When they chew tobacco, it is called smokeless tobacco. It can cause cancers of the mouth or oral cavity, pharynx, larynx, and we call it synergistic effect. That is when people consume alcohol along with the tobacco, it may lead to development of esophageal cancers, and some of the smoking may cause cancers like pancreas, bladder cancers, and in 90% of the lung cancer, smoking is the etiological factor. And alcohol causes increased risk of pharyngeal cancers like oropharynx, larynx, and just like I discussed before, it can cause esophageal cancer and hepatocellular cancers as well. And diet, that is, people who consume red meat, which is high in fat content, these people are more prone to develop cancers like colorectal cancers, breast cancer, and prostate cancers, and this is the main cause behind development of cancers, consumption of diet with rich in fat content, and other causes like reproductive history, lifelong cumulative response to estrogen stimulation, and particularly if unopposed by progesterones, increases the risk of cancers of breast and endometrium. And in patients who consume OC pills, they may get they are a very high risk of cancer. And in patients who has obesity, the risk of endometrial and cancers like risk of cancers of endometrium and breast, they are at a high risk for development of these cancers. And environmental carcinogens like chemical carcinogens like pesticides, patients are more prone to develop cancers. And and some UV rays or ionizing radiation, these patients who are exposed to these rays may develop skin cancers, which are not common in India. And some of the microbes like bacteria, viruses, like we discussed before, they also can cause cancers in the population.
Okay, doctor. As you discussed with etiological factors, can you identify that cancer in the early stages, doctor?
Yeah, cancer can be identified in early stage, and when cancers are identified in early stage, they are very curable. This is not all. The most common thing how we detect the cancers early is by screening. Screening can be done in the normal individual before development of symptoms in the normal population. But not all cancers can be screened. Only few of the cancers like breast cancer, cervical cancer, these cancers can be screened in individuals. Development of after a certain age period, we can start the screening procedures. And in some patients who has familial history, they can be offered screening from a particular age for some particular cancers, based on the family history, based on their family history.
What is screening in cancer and how do we undergo screening?
Screening is nothing but some tests can be done in the normal populations, in the general population, before the signs and symptoms of the disease appear. This is called cancer screening. The main goals of screening is to reduce deaths due to cancer and to prevent cancer deaths, and to reduce the number of people who develop the disease. So these are the main goals of screening. So some cancers screening can be done, like in case of cervical cancer and breast cancer, and in some cases of colorectal cancers and head and neck cancers, lung, prostate, skin cancers. These are the common cancers where people has to undergo screening for the early identification of the disease. So for breast cancer, some of the tests like mammography or clinical breast examination and self breast examination, and in some high risk individuals, MRI imaging, these are the common modalities for the screening of breast cancer. And for cervical cancer, in India, usually pap smear can be done for the screening of healthy population. And in case of any discrepancies in the pap smear, moderate or high grade dysplasia, HPV co-testing can be done as a screening modality. And in case of colorectal cancers, regular colonoscopy or sigmoidoscopy or fecal occult blood test or a barium enema or stool DNA test. These are the common tests done for screening of colorectal cancers. And in case of head and neck cancers, a regular examination or regular checkups by a physician of nose, mouth and throat, and regular dental checkups. These can be done for the early identification. And in case of high risk individuals of lung cancer, HRCT can be done. And in case of prostate cancer, digital rectal examination and PSA test. This also should be done in high risk individuals. And in case of skin cancer, screening of skin cancer, full body skin examination and skin self-examination can be done for the screening. And for the question who should get screened, this is basically based on the age patient should undergo screening. For people of age 21 to 29 years, for higher than average risk of colon cancer, that is a family history of colorectal cancer, like in the same generation, some family members suffering, primary relatives suffering from cancers, and their younger generation having colorectal cancer and genetic disease of colorectal cancers. These patients should undergo screening for colorectal cancers with the modalities which I have discussed before. And breast cancer, same, like if higher than average risk in BRCA positive individuals, like BRCA 1 and 2 positive individuals, they are very prone to develop breast cancer. So these patients at younger age, that is 21 to 29 years, they should start screening for breast cancer. And 21 to 29 years, screening for cervical cancer is usually not needed before 25 years of age. From 25 years of age, all should undergo primary testing, that is pap smear should be done, and in case of any dysplasia, HPV co-testing can be done. If HPV co-testing is negative, after 5 years again HPV co-testing along with pap smear should be done. If pap smear is negative, then every 3 years this pap smear should be done in normal populations. And for prostate cancers, usually in this age group, any screening is not required. And coming to 30 to 39 years of age, for colon cancer, same, if higher than average risk, they should undergo screening by colonoscopy or sigmoidoscopy or fecal occult blood test or stool DNA test. And for cervical cancer as well, as we discussed, they should undergo screening for every 3 years pap smear or co-testing every 5 years. And breast cancer also, screening should be done in these individuals, in high-risk patients with MRI or mammography. Or in younger individuals, usually breast cancer mammography is not an accepted modality. So MRI should be done in higher-risk individuals, or ultrasound or mammogram along with ultrasound should be done as a screening modality. And in coming to 40 to 49 years of age, in colon cancers, all with average risk should get tested from 45 years of age. And if less than 45, again higher risk individual should get tested. Above 45, average individual also should get screened. And for breast cancer, annual breast examination with mammography is mandatory as a screening modality in all the population. And for cervical cancer, as I discussed before, every 3 years and every 5 years. And for prostate cancers, from 45 years of age, for patients at higher than average risk of prostate cancer to be get tested, like BRCA positive or any family histories of BRCA2 positive, then these patients should undergo screening for prostate cancer, like distal rectal examination and PSA. And close family members who had prostate cancer less than 65 years of age, and primary relative with the prostate cancer less than 65 years of age, then they should get screened from 40 years of age. Now, after 40, then coming to above 50 years individual or 50 to 65 years individuals, colon cancer screening should be done. And in case of more than 50 who are smokers, who are now smoking, and who has a 20 pack year smoking history. If you quit in the past 15 years and have no signs of lung cancer, and who has 20 pack years of smoking history, they should undergo low dose high resolution CT scan as a part of screening modality. Though it has not shown any improvement in survival or anything, but it will help in early detection of lung cancer in high-risk individuals, just like I discussed before. And in breast cancer, annual mammogram, 50 to 64 annual mammogram, and more than 55 mammogram every 2 years should be done. And if high risk, it should be combined with other tests. And in cervical cancer, same as above, and in prostate cancer also, just like we discussed before. And in more than 65 years, colon cancer, testing recommended up to 75 years of age. And in more than 55, a normal population no longer needed. And for lung, breast, and cervical cancer, just like we discussed before. So these are the common cancers where screening should be effectively used and should be used to achieve the goals like reduction of death and prevention of deaths caused from cancer. And if cervical cancer diagnosed and continue testing for 25 years after diagnosis, continue screening for cervical cancer for 25 years of age. Even in vaccinated individuals, cervical cancer screening should happen just like we discussed before, every 3 years and every 5 years. So this is how we screen the patients. We screen the general population for early detection of cancers.
Doctor, as you discussed about the screening, is screening available for all types of cancer?
We have discussed regarding the screening. No, there is no screening available for all types of cancers. Only for some of the cancers, like we discussed, there are screening measures available, but there is active research in place for all the common cancers like gynecological malignancies. Regarding the screening modalities, there is active research going on, and hopefully we'll get a solution soon.
Okay. Thank you so much, doctor, for your valuable information regarding the cancer. Thank you, viewers, for watching this live session. And if you have any queries, please post us in the chat box or reach out through the messenger in message box. Thank you so much.